With Robert at the ear, nose, throat, and allergy specialist, talking about his balloon sinuplasty. Robert, can you tell me what your symptoms were like before the sinuplasty?
I certainly can, but let me give you a little bit of history. Since I've been a small child, I've suffered every year with allergies. My allergies inevitably ended up with sinus infections. I've had sinus infections on an annual basis for almost 50 years now. It's been chronic, it's been just difficult having to go to the doctor, 3 and 4 times every fall and winter just for medication for the sinus infections.
So you've been on a lot of antibiotics in the past.
I have, and it constantly reoccurred. Not too long ago, I believe it was February this year of 2014, Dr. Van Tuyl suggested to me that I might benefit from a balloon sinuplasty. He explained the procedure about how he goes in with a small scope through the nose and into the different nasal passages and uses a little balloon to expand them so it drains better. And I said, sure, I'd be willing to undergo that procedure if he thought it would help. Well, I did. And I wasn't quite sure initially how it helped because I had a little bit of a runny nose after, but apparently that's normal. Here I am giving you this interview in September, so it's been at least 6 months since the procedure. I have not had one single sinus infection from then until now. My nose has been draining normally, I presume, because it's not, prior to the surgery, I've not had a normal nose working. I've had postnasal drip, I've had congestion. I can breathe freely through my nostrils now without difficulty, without clogging. I do have occasional postnasal drip, but I haven't had any infections. And I attribute that all to the sinuplasty. It's the only thing that's been different between prior years and this one. And I have just lived through an allergy season, and I'm heading into some more in the autumn, and we'll see. I think personally that this sinuplasty is going to allow me to get through the entire allergy year without a sinus infection for the first time in, as I said, almost 50 years. The procedure itself does not hurt. I will tell you though that when Dr. Van Tuyl did it for me, he gave me an opportunity to choose between being awake for the procedure or being anesthetized. I chose awake, and that was a mistake. I was not comfortable. It wasn't painful, but I was aware of what he was doing, and it was.
Right.
I didn't really enjoy that much.
Right.
I have
Most
memories
people
of
we
it.
do anesthetize. So.
And afterwards, I went to Piedmont Hospital to a forum with Dr. Van Tuyl and Dr. Robinson shortly after my procedure, and I told the folks gathered there that the option to not have the anesthesia was not a good choice on my part. Given if I had a choice to go back and choose again, I would recommend the anesthesia because a person undergoing the procedure would be unaware of what Dr. Van Tuyl was doing, and I think that would be the preferred choice at this point, having gone through the other. I am just delighted with my health since that procedure. If any of you are considering the sinuplasty due to chronic sinusitis, I'm sure you would not be looking at this video unless Dr. Van Tuyl had recommended the sinuplasty to you. I wouldn't hesitate to have the procedure.
How about your recovery time?
The recovery time was rather rapid. It only took me about 2 weeks, and recovering from the procedure itself, that was almost instantaneous. I didn't have any ill effects walking out of the door.
Mm-hmm.
But I just had a little bit of discomfort in the nasal passages for a couple of weeks, but that went away. It was no worse than having a sinus infection. And if any of you who are considering this procedure have had plenty of sinus infections, I'm sure. So I would highly recommend that you consider this procedure, and I even more highly recommend that you select Dr. Van Tile. He's an excellent surgeon.
What can you say about the staff, your instructions, and your overall general experience for this practice?
I have been a patient here for several years. I started out as an allergy patient, which really helped me with the allergy shots, but it didn't help me overcome the sinus infections. I still had them on an annual basis. So I've been a sinus patient here for several years. I have never had a problem with any of the staff or the office procedures. Everything has run smoothly as far as I'm concerned for all of my time here at this practice. Occasionally, I've had to wait longer than I cared to for an allergy shot, and those of you who get allergy shots know exactly what I'm talking about. But you know, in a doctor's office, sometimes there are days like that, and I've learned to accept that. So that would be my only complaint, and it's a minor one. Sometimes I'm a bit inconvenienced by the schedule lagging more than I would prefer, but no one can control that, so I can't complain.
Thank you for your time and for being a patient here at the ENT specialist.
You know, if I didn't like it here, if I wasn't treated well, if I wasn't satisfied with my experience here, I would stop coming. And I've been here, as I said, for several years, and I highly recommend Dr. Van Tile and Dr. Robinson and Jeff, the physician's assistant, and all of the nurses and staff. They give you wonderful patient care here.
Thank you.